Hi and welcome back to another video of Medic Notes. This video is on posterior reversible encephalopathy syndrome. PRES is a neurological disorder characterized by vasogenic edema in the brain, particularly in the posterior regions. First described in 1996 by Hinchey et al. Potentially reversible with timely recognition and management. Occurs across all age groups but commonly in adults and children with risk factors. For its pathophysiology, there is breakdown of cerebral autoregulation due to acute hypertension or other insults. This leads to hyperperfusion, endothelial dysfunction, and then vasogenic edema. It primarily affects posterior brain regions like parieto-occipital lobes, due to sparse sympathetic innervation there. In some cases, hypoperfusion and ischemia may also contribute. The causes and risk factors include hypertension, hypertensive crisis or encephalopathy. Pregnancy-related like preeclampsia, eclampsia. Renal failure such as acute or chronic kidney disease, dialysis patients. Immunosuppressive therapy like cyclosporin, tacrolimus, methotrexate. Autoimmune diseases like systemic lupus erythematosus, vasculitis. Infections and sepsis, and chemotherapy agents like cisplatin. Clinical features. Neurological symptoms like headache, altered mental status, seizures. Visual symptoms such as visual loss, blurred vision, visual hallucinations. And others like nausea, vomiting, weakness or focal neurological deficits. Diagnostic approach is clinical suspicion based on presentation and risk factors. Neuroimaging include MRI brain, which is the gold standard. T2, FLAIR, hyperintense signals mainly in parieto-occipital regions. May also involve frontal lobes, cerebellum, basal ganglia, or brainstem. CT brain to look for hypodense areas, but may miss early cases. Other tests include blood pressure monitoring, renal function tests, autoimmune panels, and drug levels if on immunosuppressants. There are a few differential diagnoses, such as ischemic stroke, intracerebral hemorrhage, infectious encephalitis, acute demyelinating encephalomyelitis, cerebral venous sinus thrombosis, and mitochondrial encephalopathy. Management principles. Treat underlying cause. Tight but careful blood pressure control. Use IV antihypertensives like labetalol and nicardipine. Avoid rapid BP lowering, target 20 to 25% reduction in first hour. Withdraw offending agents. Manage renal failure with dialysis if needed. Treat infections or autoimmune disease. Seizure control with antiepileptic drugs. Supportive care, ICU admission for severe cases, and monitor neurological status closely. For the prognosis, good outcome if recognized and treated early. Symptoms and imaging abnormalities usually resolve within days to weeks. Complications if untreated are permanent neurological damage, intracerebral hemorrhage, ischemic stroke, and sometimes death. Some take-home messages. PRES is reversible but requires early recognition and treatment. Clinical clues are hypertension, seizures, visual changes, and confusion. MRI brain is the investigation of choice. Control BP, manage seizures, and treat underlying causes promptly. That's all for this video. Thank you.